Hi guys, my name is Dr. Dan Sachiwunga and welcome to this channel where you get to know more about your health. You ask a question and it gets answered. We're trying to make sure that we bridge the gap between the doctor and the patient by giving you very accurate and right information about your health so that you can make better decisions. So today we have a very special session. We're going to be answering directly what you asked us. So we'll be right back. So welcome back to the channel. I'm here with Dr. Job Odoch. So today we have lucky 5 questions we're going to be answering. Someone asked a question, for us who once in a while drink beer, would it be correct to assume that during that moment the bladders are constantly flushed since beer causes one to urinate almost all the time? Also, do I have a urinary tract infection?
Beer has a lot of water content in it, despite the alcohol content. There's a hormone in the brain which is responsible for the body reabsorbing water from your blood. The content in beer, it suppresses this hormone, like it brings down its energy. Okay? So you find that as you take this water in beer is not taken back to the body, it's not reabsorbed. So you find yourself urinating more frequently. That is how it happens. Does that mean you have a UTI? I don't think so.
Doctor, I have a question. I ovulated 4 days ago, but I'm having a bloody discharge for at least 3 days. And yesterday I was cramping. Is it normal?
So ovulation, remember we said that's the time when your egg is produced from the ovary. Ovulation may come with some cramping. That is normal. And you may see some change in the discharge, vaginal discharge you have. Most times the discharge is more in quantity, it is sticky. And then we say it can also be pinkish. And sometimes probably there can be some blood, like spotting as well. But then it has to be in moderation, definitely. If it ends up into frank bleeding, and then the cramping goes on for more than at least 72 hours, which is 3 days, then probably there's something else going on. So I think this is quite normal. But if that cramping goes on for more than 3 days and the bloody discharge, the spotting becomes frank blood, then you need to seek medical help.
So someone asked a question. Can't a woman contract infections through the splash effect? You know, when they squat, the distance between them and the bowel is shortened. I presume the splash effect of their urine can bring bacteria from the surface of the bowel to their private parts.
This is definitely true at given points. It will depend on what situation we are in. If you're in a dirty urinal, you are squatting to urinate, and then urine splashes back to your private parts. So the dirt, the germs from the floor will definitely get back to you. Okay? It is very minimal a time that you'll get infected if your surface is clean. So that's why we emphasize that cleanliness, hygiene is very important. So yes, if you squat to urinate in a dirty place, you have a very high risk of contracting infections.
Doctor, is it possible to conceive when I'm on my period?
For a woman with regular periods, that is about more than at least 21 days, it is very unlikely that you will conceive during your periods. But then for those that have irregular cycles, especially less than 21 days, then you find that ovulation, definitely, if you subtract 14 days, ovulation will happen way earlier. And what are the possibilities? You can get pregnant. So if you have a regular cycle, it's quite impossible. But for those with irregular cycles less than 21 days, possibly it can happen.
So the last question for today that someone asked, Doctor, I had unprotected sex with my partner the other night. So today I woke up with very much pain in my penis and a yellowish discharge coming out of the penis. what could be the problem?
This most likely is gonorrhea or chlamydia, especially if it was a severe infection in the female. So you find that a man will present with so much pain the night after the sexual intercourse. So what I would say is, don't stay home, come and see a medical professional and get treated. Ensure you seek immediate medical attention. This could be gonorrhea, this could be chlamydia.
So to our viewers there, to our listeners there, we want to thank you. We've come to the end of this session. So today has been our first session where we answer your questions directly. So we want to encourage you to send in more questions through the comment section. You can directly email us those questions on our email that is flashed on the screen. So remember that we get these videos out of the questions you ask, and you're very much a part of this. We want to make sure that you're empowered, that you know more about your body, that you know more about your health. Don't forget to like, share and subscribe to this channel so that you can be informed whenever we post more videos. Thank you very much for watching, and bye-bye for today. Side of Health,
Ask the doctor.